Could doing shoulder rows actually make your shoulder pain worse? Rows are one of the most common exercises that people do in physical therapy for shoulder pain, but what's the rationale behind it? And is it really a good choice to help people with shoulder pain or rotator cuff disorders? Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain why most of the time shoulder rows are at very best not helpful for shoulder pain, and in some cases may even make it worse, plus what to do instead to actually help your shoulder pain get better. So what's the rationale behind doing rows in the first place? The reason people do shoulder rows is because shoulder pain is often caused by a rounded shoulder forward posture. And the rationale behind it is if you pull your shoulder blades back, it'll help strengthen the muscles in the back of your shoulders and get you out of that rounded shoulder posture. And the theory behind it is really good. But in practice, what happens when people are doing shoulder rows is they pull back really far like this, where the elbows go behind the plane of the body. And oftentimes it actually tips the shoulder blades forwards, which is the opposite of what you're trying to accomplish. Additionally, shoulder rows use muscles between your shoulder blades called the rhomboids. And when you use your rhomboids, they pull your shoulder blades back together, but they also rotate your shoulder blades downwards like this, which brings the arch of the shoulder down closer to the ball of the shoulder, and you're more subject to pinching the rotator cuff tendons if your shoulders are downwardly rotated and forward tipped, which again is often what happens when you do shoulder rows pulling too far backwards. Additionally, if you pull too far backwards with a shoulder row, this position where the elbow goes behind the plane of the body, it causes an anterior glide of the shoulder, where the ball of the shoulder starts to glide forward in the socket, and that forward glide of the shoulder can actually again pinch on the rotator cuff tendons. So for several reasons, the practical application of shoulder rows is at very best not helpful, and again, it might even make the situation a little bit worse. So here's what to do instead. If you are going to do shoulder rows, you want to make sure that you're just pulling your elbows towards your body. So if you're holding on to a band like this, you want to step back to where you actually are in a little bit of a rounded shoulder posture like this at the end position, and then pull the shoulders back and just pull your elbows to the plane of your body. So you're not trying to go way back like this where the ball glides forward in the socket and the shoulder blades tip forwards. You're starting from a position where you actually are a little bit rounded, and then just squeezing your shoulder blades and pulling your elbows to your sides. So it's a much shorter range of motion than most people are used to doing when they do shoulder rows. You're not going all the way back, but again, just starting out in front and pulling the elbows just to the plane of the body, and more thinking about activating the muscles between your shoulder blades than making it an arm movement. So your arms are really just hooks as your shoulder blades are squeezing together and pulling the shoulders to the sides. Now you still use the rhomboids when you do that form of shoulder row. And again, those are downward rotators of the shoulders. So they do pull the shoulder blades back, but they also downwardly rotate the shoulders. You have other muscles, particularly your middle trapezius, that pulls the shoulder blades backwards without downwardly rotating the shoulders. And you can work those muscles by doing an alternative form of row. And to do that one, you grab onto the band, you have your arms roughly at shoulder level, palms facing inwards, and then just pull backwards like that. So you're squeezing your shoulder blades together. Again, it's a pretty short movement. Your elbows don't come back behind the plane of your body. So it's almost like you're rowing outwards rather than backwards. Now you've got yet another set of muscles that moves your shoulder blades backwards. And these are possibly one of the most important muscles to work if you do have shoulder pain. And that's the lower trapezius. The fibers are oriented downwards. So they do pull the shoulder blades back, but unlike the rhomboids, they actually upwardly rotate the shoulders. Those are really important when you go to raise your arm up overhead. Your shoulder blade has to rotate upwards as you go to reach up. And to do that, you use a combination of that lower trapezius along with another little muscle called the serratus anterior. And you actually really don't need a band in most cases to strengthen those muscles. Just doing a slide up the wall like this, where you put pressure into the wall, strengthens the serratus anterior. And then if you want to strengthen the lower trapezius, you can just kind of lift up off the wall, kind of like the letter Y. So push up into the wall, that works both muscles, and then lift up off the wall like the letter Y, that works the lower trapezius. Now, if you just have trouble reaching overhead, then that's probably enough for you. You probably really don't need to add any resistance. But if you are someone who's a little bit more active, maybe goes to the gym and lifts weights, or if you're a throwing athlete and you need to be able to move things at high speed using a little bit more force, then you may have to add a little bit of resistance in that case. And to do that, you can do that with a resistance band. Just instead of rowing like this or like this, you're now going to make it more like that lift-off exercise on the wall, and then do the same Y type of movement, just with a little bit of added resistance. So if you do have shoulder pain and you have been doing shoulder rows, I'd encourage you to examine why you're doing them. Is it just something that someone has said, hey, that's probably good for you to do, or they've done those, maybe a PT or another type of therapist who just learned it from the person who came before them, who learned it from the person who came before them, or can they really give you a good rationale as to why they're doing it? And if you can't get a really good reason why you're doing shoulder rows, then I'd encourage you probably to stop and maybe try one of those other exercises as well. So hopefully you found this helpful. If you did, make sure to give the video a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.